The United States this year has experienced a series of monumental crises. And while the fourth branch of government, the media, has rightly shone a light on some of the aforementioned disasters, scant attention has been paid to, in my view, one of the largest ongoing crises in modern American history, and that's mass incarceration, or more broadly, the prison industrial complex. That is the ever expanding apparatus of surveillance, policing, and incarceration the American state increasingly employs to solve social problems instigated by social inequality. Our American justice system's approach to crime seems to me quite easy to pin down. Lock up as many people as possible. This is one of many reasons why this nation right now is presiding over the most incarcerating criminal justice processes in the history of humanity. In the last 40 years, our incarcerated population exploded from about 500,000 to more than 2 million. Our federal and state governments lock up more people and at higher rates than do any other governments in the world. And we do so more than we have at any other period in US history, with 639 of every 100,000 people in this country confined. Making matters worse, it is no secret that most people sentenced to prison in the United States today are members of politically marginalized groups. They are poor, they are Black, and they are brown. Not only are Black people 5 times as likely to be incarcerated as white people, but also the lifetime probability of incarceration for Black boys in 2001 is estimated to be 32% compared to just 6% for white boys. And the female incarceration rate, a sorely overlooked fact, has grown twice as quickly as the male incarceration rate over the past few decades. And Black women are twice as likely as white women to be locked up. But our carceral state, an astounding amount of human confinement, does not exist in a vacuum. Present events continuously impact our carceral system. And in the hurriedness to keep pace with the constant onslaught of news, I fear we are paying too little attention to how our penal institutions are adjusting to this ever-changing reality. You know, the people rely on journalists to keep them informed so that they can hold their leaders and governing institutions accountable. But the people cannot do that if the people do not have the requisite information and necessary perspective. So I'm here today to talk about COVID-19 and the American punishment system. People by now are well familiar with both COVID and mass incarcerations as problems facing the nation, but I wonder the extent to which people consider how one impacts the other. To hear our science, public health experts, and some elected officials tell it, we should refrain from gathering in groups over a certain size. We should wear masks when interacting with others to protect not only ourselves, but others. We should social distance, and we should wash our hands and use sanitizer. Of course, as simple as these guidelines are to follow, for the incarcerated, they are anything but. Indeed, it seems every day we learn of fresh new horrors tearing through our correctional facilities. Consider the Oakdale Federal Prison in Louisiana, where the DOJ Inspector General found that inmates who were exposed to COVID-19 or who had tested positive for COVID-19 were sometimes left in the general population for up to 6 days without being isolated. Think about the federal facility in Butner, North Carolina, where the ACLU alleges that no housing changes have occurred to facilitate social distancing. Or consider the Connecticut Department of Corrections, which was recently accused of failure to distribute soap and masks to people who are incarcerated. When our governments, in accordance with the best available knowledge, clearly outline steps we must take to prevent loss of life during a pandemic, while at the same time failing to follow its own guidance in its prisons and jails. Our governments declare, in essence, that the lives of prisoners, and let's not forget prison staff, are expendable. And when we don't challenge that assertion, are we not tacitly endorsing that perspective as well, capturing perfectly the entire moral dilemma that is mass incarceration, which is sweeping away people, sweeping away social problems out of sight, out of mind, so that we just rather not deal with them or confront them? I fear so. We've already begun to see the impact of this callous attitude towards prisoner lives. As of November 30th, this year, 218,000 people have been diagnosed with COVID-19, and about 1,500 of those have died. The number of infections, though, is probably higher because prisons across the country have failed to develop effective testing strategies. And many people who believe they have COVID-19 fail to report their symptoms to the relevant officials for fear of being placed in isolation that pretty much resembles solitary confinement. The risk to incarcerated people is further compounded by the prevalence of increased risk factors that they come into prison with, or that are exacerbated by prison, like obesity, like infectious diseases and chronic conditions and disorders of the immune system. Despite the unique risk posed to incarcerated people, however, the Bureau of Prisons, I'm told, has decided to use its initial supply of COVID-19 vaccines to inoculate prison staff exclusively. This decision will ideally prevent staff from bringing COVID-19 from their community into the prisons and vice versa, which is great. But that does nothing to prevent the spread of COVID-19 within the walls of prisons and between prisons through the transfer process. It's, to me, yet another instance of devaluing the lives of incarcerated people. When politicians said that older people should risk dying of COVID to preserve the economy for the younger generation, people were rightly outraged. Yet the government declares time and again that incarcerated people, pretty much, should die or suffer just because it's easier or cheaper than ensuring safety and a good quality of life. And I fail to see the same sense of displeasure. Just as this pandemic has exposed pressure points of our highly polarized government, revealed a need for an improved approach to healthcare, uncovered gross economic inequality, and made clear our nation's century-old struggle with racism, so too it has opened the eyes to the many failures of our prison system and of our perspective on crime and punishment. Among my colleagues in the reform space, I see a combination of fear for those incarcerated today and hope that this pandemic will serve as the catalyst for real change. That seeing our failures laid bare will inspire the people through their leaders to take a new approach that is more focused on the humanity of incarcerated people and the potential for rehabilitation, and that we will reflect on our beliefs and begin to understand that we are complicit in a system that brings untold harm to countless people. Despite the overwhelming bad news coming from our prison system during this pandemic, there are signs of positive change too. We are seeing increased rates of early release from prisons and jails, reduced prison and jail admissions, the easing of some onerous probation and parole requirements, the elimination of medical copays, and reductions in the cost of contacting the outside. The Prison Policy Institute has documented 48 instances of local and county systems releasing people with risk factors for COVID-19 from jail, and 41 instances where states have instituted some sort of early release from prison for individuals with risk factors. Some of these early releases have provoked anger and controversy. But the pandemic provides a response to that outrage and political cover to lawmakers and law enforcement officials who enact these changes. So this strikes me as an opportunity to display to the public that not everyone in prison, not even all so-called violent offenders, pose a threat. The ACLU conducted a study of 29 cities and found no correlation between early release and increases in crime. We are seeing early evidence that this narrative, that early release equals increased crime, is simply inaccurate and ought to be abandoned. Decarceration is not dangerous. Decarceration, along with social services, is restorative, and it is important that the narrative be more widely shared. We are not only releasing people early, but we are also, it seems to me, more hesitant to put people in prison and jail in the first place. 4 states, including very conservative Oklahoma and very liberal California, have at least temporarily halted new admissions to state prisons for low-level nonviolent offenses. And 20 localities have enacted policies to reduce jail admissions. While these policies are only temporary, they raise the question that we should explore. And that is, if our government feels confident temporarily halting prison and jail admissions for a great number of people will not pose a public safety risk, then why do those people need to be in prison at all? We should not be so comfortable with a government that is so willing to incarcerate people who need not be incarcerated. We should also look to reforms in parole and probation. 6 states have reduced unnecessary face-to-face contact for people on probation and parole, replacing in-person check-ins with virtual check-ins via text, via telephone call, email, or video call. These reforms should have and could have been implemented so long ago. We shouldn't be requiring individuals, many of whom lack easy access to transportation and jobs with scheduling flexibility, to regularly travel long distances for in-person check-ins. We should be making reintegration into society as easy as possible. There are so many practices in our justice system that fly in the face of common sense. We hold people sometimes 100 miles from home, but charge crazy amounts for them to just call home or video chat home, which makes reintegration upon release much, much harder because they've lost touch with their families and networks. During the pandemic, 4 jurisdictions have eliminated the charges for telephone calls and video calls. Contacting home, a lifeline for incarcerated people, should not cost money. We also pay incarcerated workers abysmal wages, the average being between 14 and 63 cents per hour, and at the same time charge medical copays that are equivalent to charging non-incarcerated patients $200 to $500 per medical visit. Of the 39 states that charge incarcerated people for medical copays, 11 have suspended all medical copays, 27 have suspended copays for those with respiratory symptoms, and 1 has made no changes at all to copay policies. Healthcare, of course, we know, is expensive in this country, and there is and ought to be a raging debate over the cost and approach to providing healthcare. But there should be no debate over this. It is just reprehensible to me to pay somebody between 14 and 63 cents an hour and charge a copay. A person earning a low-wage job, or excuse me, a person simply learning or earning a low wage would need to work over 14 hours and save all the money they make to afford a $2 copay. So at bottom, should we applaud the reforms made in the justice system to confront COVID-19? Of course, they are a most welcome development. But we should also be asking more critical questions. We should be asking why our system is so deeply flawed that these changes hadn't been implemented years ago. We should be asking why we continue to hold people who are not dangerous, why we admit people who are not dangerous, why we make re-entry into society so difficult, and why we pay people in prison so little, and yet we charge so much in certain instances like medical copays. Our perspective on law enforcement is flawed. We would rather harshly punish transgressions rather than, it seems, prevent crime. We would rather punish than rehabilitate. And we need to think about why that is and how we can work to change not simply our policies, but the way we view, the way we understand, and the way we implement justice. Of course, as journalists, you have the power to influence the national conversation, and you can raise these conversations to the forefront of the nation's mind. We can and should talk about current events, but we should also focus on the deeper meaning. Of course, infection rates are important, but infection rates are not the full story. The story is our country's willingness to lock away people and throw away the key. It is our refusal to acknowledge the humanity and the value of those who are incarcerated. It is about a country with such a broken system and such a harmful perspective on justice that we have designed and allowed such a broken system to flourish. Thank you.
Thank you, Hernandez. There's a lot of food for thought there, but let me start off with a question. We're now, as far as we can tell, we're talking about a new surge on top of the existing surge in COVID-19. And as you mentioned, a lot of the changes that have been going on in throughout the correctional system and even in jails included, such as early release of prisoners, different approaches to how to treat infected prisoners and testing them. But all these are temporary. So do you have any expectation that as we continue to endure and suffer through the pandemic, that these temporary solutions will continue? Or do we think that authorities are just going to say, look, enough is enough. We don't have the money, we don't have the staff to do anything else, and we're going to have to start tightening up again. Is there any indication of that?
I haven't, it's hard to sort of read the signs of what prison officials and states and jurisdictions might do. It would seem to me that if there's enough pressure placed politically, that maybe some of these changes could stick, but there's just doesn't seem to be the appetite, even mid a pandemic, for there to be lasting change, which is quite unfortunate. I just haven't heard or read about states that have, indicated that, post-pandemic, they're interested in changing policies, being more compassionate, because it seems to me that the only reason that we're seeing any of these changes is because of the pandemic, probably because there has been some light shined on the injustice of it, but more likely because people are concerned about the pandemic spreading beyond the prison walls by prison staff, which makes people rightly afraid and want to do something to control that particular environment. But I don't think that, in other words, were we not in a pandemic, and of course this is consistent with the reality before the pandemic, that if there weren't some threat to people in power, to people with clout, to people who have political power, if there weren't some threat to their lives or livelihood, I don't think that there would be as much appetite or the sort of movement that we've seen to address some of these very common sense, basic ideas, like not detaining people who don't pose public safety risk.
Just to before we go to take some questions from the journalists, I want to go back to the point I was raising at the start about the priority for vaccines. That's what everybody's focused on right now. I don't see any change yet or any decision in deciding, who gets priority. And obviously, it's got to be done on a state by state basis. Can you take us through the system and what your feelings are about the kinds of priority to give to, I guess, both inmates and staff? Staff are I think now being regarded as essential workers, correction staff. They're in phase 1B. If I think I'm not sure if I got it right, but I'm not sure where detainees and inmates are. Can you help us out in that?
So, to be quite honest, I'm not too read up on where prisoners are on the list. If there is a list.
Where should they be? I mean, should they be as same priority as staff and correction and other corrections personnel?
Well, I won't. I won't say that I think that they necessarily should be in the same category as essential workers like nurses and doctors and other kinds of essential workers. But in terms of the most critical populations, they seem to me akin to nursing homes where the problem is most profound. So after essential workers, if the list looks at where is, the problem the worst, it seems to me that prisoners in prisons, jails should rank pretty high up there with nursing homes. And if the only reason that they're not up there is because of this, idea that, well, they're in prison, they're there for a reason because they've done bad things, or, if it reflects the thinking that we just don't prioritize them because they're out of sight, out of mind, I think that is a big problem to me morally, because they're just, they are there because they have committed crimes. They are not there because they have been sentenced to die and contract COVID. And so it seems that if we value human life, if we, are a society that cares about people, we care about people in nursing homes, we should care about people in prisons as well.
Okay, we have a bunch of questions that are starting to surge up. Speaking of surge, let me ask Michael to read the first question out. We've got one in order from Grayson Danger, and then we'll go to the others. Michael?
Yeah, sure. So Grayson Dangor, who is a contributor at Forbes, asks, how do incarcerated people pay copays? Is it through the same account they use to pay for calls and commissary and other things? Also, if someone who is incarcerated doesn't have the money for a medical visit copay, do they take away any money from those other things that they could buy? And if they don't have the money, do they go into debt in their commissary accounts?
Those are all very good questions that I do not know the answers to how copay works in prisons. And specifically, if they don't have certain monies, where those monies might derive from or go towards, if it's some debt or something. I just don't know the specifics of how prisons handle the intricacies of that. My suspicion is that it could be different, in different places. I would not be surprised if there is some debt that's accrued because, fees and fines is not something that's new to people who are incarcerated or formerly incarcerated. And even while they are locked up, they, in many other instances, accrue debts that must be paid upon release, which is an interesting concept. So that would be my response.
One of the issues that I've seen in that same area is who pays for the vaccinations. I mean, we have in some states, of course, which have not accepted Medicaid, so a prisoner or an inmate could get a vaccination free inside the facility, but some vaccines have to be given in 2 doses. So once he or she gets out, Medicaid will not necessarily pay for the second dose, which of course undermines the entire point of that vaccination plan. It's I don't think a lot of these questions are resolved yet, or people have begun to think about who pays for what, and the whole Medicaid question obviously complicates it. I have the next question from Gareth Gabriel. Michael, do you want to read it out?
Sure. So Kareth Gabriel of the Philadelphia Weekly asks, given the COVID-19 surge, should there be consideration for a hazard pay of sorts for prison workers? Incarcerated individuals are still being asked to do work under the added stress of contracting the coronavirus, or is this just too lofty of an idea for states and municipalities to consider, given that we are talking about incarcerated individuals?
You know, I think that the latter sentiment probably captures the reality of the situation. I mean, people in prison they have no workplace protections, which is why, you know, in other words, they're not protected by any sort of federal laws that or state laws for that matter, that usually, at least, that normal workers might be protected by. And so it is hard to imagine that even though we're in a pandemic, that states would step up or the federal government, maybe the federal government at some point in the new administration, but even that seems incredibly unlikely given that a lot of people are in prison through the state system. It just seems unlikely that states would have an incentive to provide those sorts of benefits to prisoners. I mean, they're still paying prisoners so little money. It's just hard to imagine that there would be the political will unless there was some, as I mentioned before, threat to the general public or to people who have a lot of say-so in our government. Absent some sort of consideration that would motivate those people and their interest, it's hard to imagine that states would do much more beyond what they're doing, which is why you're seeing the sort of abuses take place, in my view.
I want to put together two questions which are sort of related. One from Ronald Burler, who wonders whether the prison issues might be able to be more salient if incarcerees were included on each facility's policy board. And he's wondering whether there are any prisons or any facilities where that actually happens. And sort of related to that, from Lynn Anderson, who wonders whether who is actually lobbying the CDC or the ACIP to get prisoners on the priority list for vaccines. I don't know if you're aware of following that, Hernandez, but if you do, that'd be great. It's a great question to get an answer to.
Yeah, so I'll take them in reverse order. In terms of who's lobbying, that's a great question. We haven't been tracking that very closely. So I can't provide an answer to that. And if you could just repeat the first question, I didn't quite get that.
Well, the idea is that whether incarceration in any of the facilities are actually on the policy board inside those facilities, who could thereby have a voice in both in ameliorating the conditions under which people are living and how they might counteract the effects of the virus.
Yeah, I can't remember where, but it does seem to me that in certain places that sort of arrangement exists, which I think might account for at least where we've seen some beneficial, advantageous changes made in the way of safety and cleanliness and precaution in this pandemic. It seems like where that has happened, those sorts of arrangements where prisoners do have some sort of voice, it seems like that's where we're seeing those sorts of changes take place. But, you know, by and large, those arrangements really don't exist, and to the extent that they do exist, they're not reflecting or producing the sort of outcomes that I think that prisoners would like to see in their facilities.
There's a question from an anonymous attendee that maybe follows from that, and then I'll there's another question after that from Lynn Anderson, which is a really good one. But I'll read the anonymous attendee's questions first, who asked whether you can speak to some of the unique risks faced by incarcerated women during the pandemic. You mentioned that in your opening remarks, so if you can expand on those, it'd be great.
So, in terms of increased risk to women, I mean, there are I had read just a few weeks ago that women were not getting certain products that they need, and some of the challenges that women face are, like I'm trying to communicate, are sort of unique to them. But basically, the main thing is that there's no sort of coherent testing strategy. There's been no reconfiguration of housing to allow for social distance. There's been no sort of increase on cleaning. So all of those are not really unique to women, but they're unique to all prisoners and staff. And so I think the biggest challenges that women face are in many ways shared by men. And it's mostly around these basic things that the government and science and experts have said we need to do, that are practically virtually impossible in a carceral setting.
There's two questions that are also very closely related, which maybe Michael can read. One from Lynn Anderson, and the second one from Kelly Davis. They're long questions, but Michael, maybe you can abbreviate them a bit.
Sure. So Lynn Anderson asks, do you have any suggestions as to how journalists can gain or increase public attention to the broader questions you are raising about justice and injustice? This seems like an important moment in history to do this, but I don't know how best to tell these stories. And similarly, Kelly Davis, who's a freelance journalist, asks, none of the studies that she read, none of the studies, news reports, or lawsuits seem to have really moved the needle. So what should we as journalists do now, and what should be our next step?
Well, those are very big questions, and I'm glad that you're thinking about them, because prisons and jails, as you know, probably as journalists, it is so difficult to get information about what's going on inside of those facilities. Even if you're bringing a lawsuit, sometimes it's incredibly hard because prisons and jails and wardens and those officials can simply hide behind certain legal theories to protect themselves from disclosing information that would be very useful, I think, for the public to know. I think that to the extent that it's possible, if journalists can elevate the voices of currently and or formerly incarcerated people, the families and loved ones of incarcerated people, if you can talk to community organizers who are working to secure positive changes, I'm just iterating ways, I think, of ways to boost awareness. I think pushing lawmakers and policymakers on some of the reforms we've talked about. I think questioning the new administration about some of the questions that we talked about, like equitable distribution of vaccines. That's a very fresh issue, I think, that will have to be addressed. And I don't know what the answer to that might be. But at the end of the day, I think it's going to be critically important to try, and this is so hard, I think, to tie the interest of people in prisons to those on the outside in order to get people to care. Because with mass incarceration, people care about economics, for example. And so if someone says, oh, well, I don't, really feel comfortable with mass incarceration because of an economic issue, that's different than, moral outrage, but they, still care about the problem. I think it takes tinkering with different ways to package and present the information in trying to hook people in who might not otherwise have this sort of moral outrage that maybe a lot of other people think that they should have. So that's a Herculean task, and I know that for journalists it's incredibly hard, but I think that is the goal.
So we've still got a bunch of questions, on deck, but I want to just follow up with a quick one from Terry Collins at Huffington Post, who wonders whether, since you mentioned lawmakers, whether there's any particular ones you can single out who are actually working on the side of incarcerees to make sure they get vaccinated. And just further following up on that, are you aware of anybody in the advisory committee that President-elect Biden is nominated for the the pandemic advisory group, who is particularly focused on the correction system and incarcerees?
So for both questions, I don't. I mean, so my mind for at least the question about who in particular among lawmakers would be good to focus your attention on the crosshairs at. It seems to me that there could be some bipartisan support. I know that Mike Lee, I think, has expressed some interest. I think, there are a lot of Democrats. I'm not familiar with who in particular would be the best person to look at.
What about on the state level? Because you were an aide to in New Haven for a long time. Connecticut has been progressive in a lot of ways. I'm not sure whether they are in this area.
Yeah, it's been a while since I've followed New Haven politics, to be honest. That was back in 2016, and even the mayor has changed.
Ancient history again.
Yeah, so I'm not as familiar with the landscape or the cast of characters as I once was, but it seems like the state level would be particularly useful to target, because that's, again, where most of the imprisonment happens. And I think that the more local you get, I think the more opportunity there is for some real change, at least based on my experiences.
No states or state legislators you can point to that you know of who are working further or much further ahead than others?
Not off the top of my head, no.
Okay. And the question about the the Biden commission, is there any part of that that's focused on the correctional system?
I have not come across that information. It may well be out there. They're putting together a lot of their team right now. I know that the commission or the group on COVID has been assembled, but and there are subgroups within that. I would wonder whether within the largest COVID group, there's a smaller group that's focused on incarcerated settings. There might well be that information. I just haven't come across.
Certainly worth asking, because it's not on anyone's radar screen.
Right, those are important questions.
So we're about 5 minutes just behind our schedule, but I wanted to add one last question from Victoria Law, who asked an interesting technical question. She's noticed that the number of tests reported, that's coronavirus tests, are fluctuating, that in some correctional systems the number of tests has dropped, The BOP reported that 1,293 people were tested last week, and 1,288 were tested this week. It's not a major drop, but any idea why there are fewer tests than in the previous week? I mean, are there less people maybe to test? Is that part of the release issue?
Yeah, it would be total speculation. You know, I guess it's hard to really say why there are less deaths. I'm not aware of something that has happened that would account for there being less deaths. Like there were some new policies that were implemented. Maybe it is that something was going on where you saw states or jurisdictions doing something different. It's could be something like that. I'm just not sure.
I guess more transparency would help. That would be a good start. You didn't mention that in your opening remarks, and nobody's asked about that, but that's certainly something that's been lacking throughout this whole crisis.
Yeah, it's so hard to get information about what's going on in penal institutions. I mean, I know from past work, clerking for different judges, that prisoners and prison officials really are protected well by the law, that such that transparency is not really the same thing that it means to me that it means to them.
Okay, we'll have to leave it there, but Hernandez, this has been great talking to you. We could go on, of course, for another half hour, I think, but people who do want to get in touch with you for more questions, we'll give them your contact information.
Great.
I thank you very much for joining us, and please stay with us for the day. But meanwhile, we're going to take a 10-minute break. We're just about 5 minutes behind our schedule. I'm going to check to see if our technical issues have been resolved. But otherwise, take a quick break, relax, have some coffee, and we'll be back about 1 o'clock. Thank you.